Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today we're going to talk about massive weight loss surgery. You put in the work, you lost all of this weight, whether it be with a nutritionist, diet, exercise, surgical interventions, injectional interventions, whatever you did, you put the work in. Now you lost the fat and now you're left with the skin, which is now the remnants of the heavier you. So now we're going to talk about the interventions or the cleanup that we do after massive weight loss. And what I usually like to do is ask the patient what is important to them and prioritize the areas that are the most bothersome to them from the most important to the least important. Because let's face it, we're not going to be able to do all of the surgeries in one session. We commonly do split them up or stage up the surgeries to make it the safest manner possible for the patient. Commonly, patients do end up preferentially splitting their body into the areas that they see every day, which is the front part, and then the back area, which they don't see as commonly, tends to become lower on the priority. So what I mean by front is most commonly the breast, the belly, the arm area or the thigh area, and then for the back or the posterior aspect, it can be the back or the waist or the buttock area. Let's start from the top down. When it comes to significant weight loss, a lot of women will see deflation of the breast and sagging of the breast. Depending on what look the patient is trying to achieve, we will commonly do a breast lift with some kind of augmentation. In a previous video, we talked about the use of fat grafting for volumization or using an implant such as silicone and saline implants to create volume to the breast. Another common area that people like to address is the torso. So the abdomen, the flanks, and the overall waist area. Depending on how much skin laxity you have and how much skin needs to be removed, there are different types of abdominoplasties. The most common type of abdominoplasty or the standard abdominoplasty has the incision in the lower bikini line and the incision around the belly button. If there is more skin laxity, the horizontal incision in the underwear line can extend out to the back, and in some instances it can go all the way around in what's called a circumferential abdominoplasty or a belt lipectomy. In other instances where there is a significant amount of laxity around the sides, we can do what's called a fleur-de-lis abdominoplasty or an open book abdominoplasty, which has that added component of having a vertical incision that goes up and down the middle of your abdomen. Those are ways that we address the front part of the body. Now for the extremities, so the common arm lift or the brachioplasty is when patients have that excess skin or the bat wing. I know patients love doing the shaking of the arms to show the skin laxity, and that excision really depends on how much excess skin you have. The length of the incision can vary in different individuals. If it's just a little bit of skin laxity, that incision can be confined to just the armpit, but if the skin itself is extending from the elbow, then the scar will also extend from the elbow. So it can go from the elbow all the way down to the armpit. If you are combining it with a breast procedure like a breast lift, that incision can actually connect with the side of the breast incision. For the lower extremities, such as the thighs, you can have the vertical component on the medial thighs or the inner thigh area, and that really depends again on how much loose skin you have. And so your surgeon really needs to talk to you about how the scars are going to appear based on how much skin you need to remove. Flipping the patient to the back. Now, in some individuals, they may only have loose skin in the waist area. And by waist, I mean the area where your belt sits. So those people, a circumferential abdominoplasty may be an adequate option because they're really just cutting out the loose skin in the belt area. However, there are individuals that do have loose skin where their bra line is or where their mid back is. So in those individuals, a torsoplasty might be a little bit more appropriate where you are removing the loose skin in your bra line. Now, some individuals might notice that they have sagging or loose skin in the butt area. And I've talked about this in another video called diaper butt syndrome, where the skin has kind of sagged down. Now, in those individuals, a posterior lift or a gluteal lift with or without auto augmentation might be a better option. And what I mean by that is that those individuals who have sagging of the butt, you actually have to lift all the skin and tissues from the lower butt area and restitch it up to that belt line. So it's a little bit different than a belt lipectomy lipectomy, because a belt lipectomy is actually addressing the loose skin that's above that incision or where the belt is. And a posterior lift is different in the sense that you're actually lifting all of the tissues that have sagged down and putting them in a higher, tighter space. Briefly, now I'm going to talk about the changes that we see to the face after massive weight loss. When you do lose a significant amount of fat, obviously you will lose volume to the face and can potentially make you look older from the sudden weight loss. For these individuals, we can use a combination of non-invasive and invasive measures to address the skin laxity or the volume loss. So obviously we can use fillers to add more volume to the face if you are looking a little bit more sunken in from the weight loss, or if the amount of skin that has been left behind from being in a heavier state, commonly the lower face area, the neck area, something more invasive such as a facelift or a neck lift might be more appropriate. So remember, the weight loss journey is a journey, and to address the after effects of such a significant change will take time and multiple sessions. So don't be disheartened. Make sure you find a provider that is able to come up with a good plan for you that fits your needs and is able to do everything in a safe manner. And it may seem like a very long process, but we don't want to be impatient and try to do everything at once. And potentially it can take several years to really address all of these different body parts. But be patient, have a good support system, because you are going to need your friends and family around you to be able to support you throughout this process. You've proven yourself, you've put in the work. I'm proud of you. Just be patient and be kind to yourself. I hope you guys learned about the different procedures that we do after massive weight loss. If you like these videos, please subscribe. Thank you.